Prime Minister Boris Johnson has confirmed that England's lockdown will end next week, but it's going to be replaced with a three-tier system of regional restrictions that are set to last until spring of 2021. Here to discuss, we have Bloomberg opinion writer Therese Raphael joining us now from London. Therese, you've been critical of Britain's COVID response, but in your column that published today, you write that Johnson's winter COVID plan deserves 2 cheers and 1 Hail Mary. So what's changed when it comes to Johnson's winter plan?
Response to now, as I think has been known, has been characterized by all sorts of problems, from not having enough PE to a testing system that didn't provide enough tests, turnaround was slow, and the contact tracing system didn't work. So all of that is quite familiar. What's changed? Well, there are scientific developments that are potential game changers for Britain. One is these rapid diagnostic tests called lateral flow tests. Johnson has a whole load of them and rolled them out in Liverpool, which is one of the worst rates of infection in the country, as a pilot program to see if that can help bring down the infection rates. And so far it seems to be working. And so there are plans now to roll out these tests in 67 areas of England, but they're also going to be used for weekly testing of the NHS, National Health Service staff, for nursing homes. So what that does, it identifies infections perhaps before people themselves know that they have the virus. It then encourages them to isolate if they've got it. It encourages more confidence for people who've tested negative to maybe go back to the shops and the restaurants and circulate. So that's one big new change. And the other one is the AstraZeneca vaccine.
Right.
So whereas the Pfizer vaccine, we only had 40 million, I think, doses on order. AstraZeneca, it's homegrown, it's in production, it's cheap, and Britain has 100 million doses.
Well, Therese, and I want to apologize to our viewers. We are having a little trouble hearing you. Your signal's going in and out, but we can hear you now. What's it like for you on the ground there? What has it been like to be experiencing this in London, the second lockdown and the changing of restrictions?
The second lockdown has been easier than the first lockdown. I think we all got used to, some restrictions and what we could do. But in the second lockdown, we still have, some people are going to the office, restaurants are delivering. People have become more creative about, how they leave their houses, go to Target. We still have a ban on meeting other families indoors. We still have restaurants are closed. There's no hospitality industry. Retail is closed. So, it still feels like a country whose economy has been put into deep freeze. And that ends December 2nd. And in its place, we're going to get a tiered system of restrictions that's still going to feel pretty grim to areas where infection rates are high, but we'll feel a lot better in other areas where, say, retail and hospitality can open up.
When it comes to Boris Johnson's decision-making and the way that he's gone about this, what do you make of the team that's been around him, or at least at this point, the lack thereof? We've seen Johnson lose key people like Dominic Cummings, and I wonder how that's affected his decision-making around this.
There's been a sense from the start that this has been policy made up on the hoof. It's not been very well communicated. The strategy has changed. We've often been behind other countries who've shown more effective ways of dealing with the virus. I think what we're seeing that's different now is the government has learned from some of these mistakes. So the way it's going to institute these tier systems takes on board some of the things that didn't work at the last hearing. And obviously these two developments, the vaccine, if it gets approved and rolled out on time, and the fast testing, if that continues to be effective, will enable Boris Johnson to potentially vaccinate the entire population that's vulnerable and older by Easter, and perhaps, the whole of the country in the course of next year. And that just opens up an opportunity for him to really reset the government, to focus on the economic revival. Now, we haven't said the B word, Brexit, bring it into this conversation maybe, but if we're just looking at virus response, he may be lucky if he's got those two tools in his, in his toolbox to work with, and perhaps that will start to make up for some of the poor decision making we've seen up to now.
Bloomberg opinion writer Therese Raphael joining us live from London. Thanks for your time today. We appreciate it.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.